Hey guys, I'm Dr. Greg Judice with Judice Sports and Rehab. Today we're going to be talking about elbow injuries with baseball. Baseball is my favorite sport. It's the sport that I grew up playing the most. And here in St. Louis, we're obviously a huge baseball town. We got the Cardinals and a lot of baseball lovers here. So I wanted to go into what type of elbow injuries are most common, and then what prevention would look like and what recovery would look like if we do have someone with an elbow injury. So why do we call it Tommy John surgery, right? So Tommy John surgery is one of the surgery that is from the most common injury with a baseball player, and that's typically an elbow injury with throwing. And so they call it Tommy John surgery because the first surgery was performed on Tommy John. He was a baseball player back before my time, but he tore his UCL, which is the ligament on the inside of the elbow. So now a lot of youth baseball players call that kind of like a badge of honor, having a big scar through the inside of the elbow. But honestly, the best thing to do is try to avoid that injury in the first place. In St. Louis, we've got a couple of players that have had Tommy John recently. Lance Lynn, he's not with us anymore, but he had Tommy John surgery. I think that was 2016 season he missed. And then Alex Reyes, his first injury, the reason he missed last season was recovering from Tommy John surgery. So that UCL, that ulnar collateral ligament, that ligament on the inside of the elbow, it's a very thick ligament. And if you remember back last week's live video, we talked about the difference in mobility and stability in the upper extremity. So every other joint is mobile and every other joint is stable. And the elbow is supposed to be a stable joint. So that ligament is really meant to keep everything stable and allow you to move normally, but not allow that elbow to move too much. Because of the mechanics and because of the motion of a baseball throw, especially a pitch with such high force, because of all of that, that ligament can be stressed. And each time you throw, as you reach back, that ligament gets stressed on that inside part. And so over time it can tear, and that's when we have to have that Tommy John surgery. One thing I wanted to bring up as well, that's not the only injury that can occur at the elbow. There's a lot of different things. You hear of different people having numbness and tingling, different types of folks having like a pronator strain, and these are just different types of injuries that can happen through the elbow. But because the Tommy John and the ulnar collateral ligament tear is the most common, that's what we're really going to be focusing on today. Another question I get pretty often is, why does it take so long to heal after this type of surgery? You see most people that are having orthopedic surgery of some sort while younger, and it's not a joint replacement. Typically that time frame is somewhere in that 6 to 12 weeks, whether it's a fracture or a torn muscle or something like that. Typically that healing time is 6 to 12 weeks for most injuries. But for the Tommy John surgery, because of its unique nature being a ligament tear and then a full reconstruction, it actually takes quite a bit longer to heal because it has to go through a process called ligamentization, which is a long fancy word basically saying that when they reconstruct it, they use a graft of a different tendon from somewhere else in your body. When they do that, that tendon or ligament that they have pulled out from one part of your body has to become a ligament that works in the new part of your body, which is your elbow. So it takes almost twice as long for it to heal fully. So you're looking at 6 months just to be able to begin throwing and just to be able to begin getting back into baseball activities. Now, during that first 6 months, we're still strengthening, still working on shoulder blade strength and core strength and rotator cuff strength, and there's a lot of different things that you can certainly be working on during that healing period. But the issue is you can't get back to throwing for at least 6 or 8 months. because baseball is so specific, and because pitching is, it has to be so accurate, it's a lot more difficult to get back to pitching at a competitive level that quickly. Because it is so mechanically, it has to almost be mechanically perfect to throw a pitch for a strike. A lot of pitchers, it takes quite a bit of time and practice to get back to the point where they can pitch in a game again. So if someone goes out with a Tommy John surgery sometime this year, they're pretty much guaranteed to not be back anytime this year or at the beginning of the following year, or the beginning of the next year. So it typically takes somewhere 9 months or more to return to sport at full participation. So that's pretty typical timetable, and it's just because of the nature of the sport and the nature of the repair. But most injuries don't take quite that long. Like I mentioned earlier, the best thing that we can do to prevent that much time on the shelf or that much time injured is to prevent the injury in the first place. A lot of my postdoctorate research was on pitching mechanics, and so pitching mechanics, as well as pitch count, as well as the way that you move your body in general and your strengths, decreases the stress throughout different parts of the body. And pitching mechanics has a big deal, is a big part of the stress that goes through the elbow. Another thing that I see pretty often, and especially in kids, is early specialization. I see a lot of kids that are, 13, 14 years old, and all they play is baseball, or all they play is volleyball. And they're not playing those other sports and moving their bodies in different ways. Let me grab a quick sip of water here. Get kind of dry. And that early specialization, basically, they're not moving their body in a different way to change. They're not an athlete. They're just a person who plays a sport. And that's not what coaches want anymore. Early specialization does lead to injury. Almost 70% increase in injury rate by people that, by athletes that specialize too early. And that doesn't go just for baseball. People that can have elbow injuries, or any overhead athlete. So even something as simple as swimming. Just because it's not a throw doesn't mean it's not an overhead sport that has a lot of repetitions that can become stressful. But volleyball, tennis, swimming, softball all have similar injury characteristics to a baseball throw, just because of the motion, that overhead motion or repetitive motion of throwing. I think we kind of got into enough about what that injury looks like. There are plenty of different injuries that can go on, and obviously the goal is to avoid the injury in the first place. Again, part of my expertise is observing and correcting mechanics, and I have a great pitching coach that I work with for my athletes. So if that's something that you see in your kid, that they're having difficulties throwing strikes or having some pain, definitely encourage you to reach out to me, and I can take a look at them. And the last thing, I'm in the process of developing an arm care ebook, which is basically like a resource that you can use to help strengthen your shoulder blade, and elbow, the areas around there, to make sure that you are safe when you're throwing, or make sure that your kids are safe when they're throwing. So if you guys have friends or family members that have pain with overhead motions, that would be a good time to suggest they come take a look. We do offer a complimentary discovery visit, and I would love to make sure that they're not going to be at more risk for an injury down the line. So I think that pretty much concludes this week. Figured we'd talk about baseball since it's All-Star Week, but anyway, I think that wraps it up, and we'll be back next Friday. Thanks, guys.